Okay, so you guys sent in this document. It's about seizure protocol for paramedics.
Right.
And wow, there's a lot to it.
Yeah.
I was kind of surprised just how much goes into responding to somebody having a seizure. So, it's a good thing we're diving deep into this because this is, life or death stuff.
Absolutely.
I mean, we're talking serious business here, right?
Yeah, so first off, maybe we should define like what exactly is a seizure.
Yeah, that's a good point.
So basically it's like an electrical storm in the brain.
Okay.
These sudden bursts of electrical activity, they can really impact behavior and movement and even awareness.
So if you're a paramedic, you show up on scene and somebody's having a seizure.
Yeah.
I mean, what's going through your mind?
Well, the first thing, and the document really emphasizes this, is you got to look beyond the seizure itself. You're like a detective, looking for clues, because a seizure can be a symptom of something much bigger.
Oh, wow.
There's a ton of possibilities like stroke or low blood sugar, even
Yeah.
problems specific to certain age groups.
So it's not just about stopping the seizure. You have to figure out, like, what's causing it.
Exactly. You have to get to the root of the problem.
That's amazing.
Yeah, like let's say your patient's pregnant or just had a baby.
Okay.
A seizure could be a sign of eclampsia.
Eclampsia.
Yeah, it's a serious complication that can cause seizures, coma, even death
Wow.
for both the mother and baby.
Oh, my gosh.
So, getting a good medical history is super important.
Okay, so that's a lot to think about. But the seizure's still happening, so what are you doing right then and there?
Well, you got to protect the person while you're gathering information,
Okay.
The recovery position is key.
Okay.
It keeps their airway open so they don't choke or aspirate,
Aspirate meaning?
inhaling vomit.
Oh.
Obviously, you also want to prevent injuries, from falls or hitting something.
So you're really actively working to keep them safe.
That's right. And all the while, you're carefully watching the seizure itself.
Like, what are you looking for specifically?
Well, things like eye movement,
Like, what do you mean by eye movement?
like which direction they're looking. If their eyes are deviated, it can tell you
Oh,
which part of the brain the seizure's coming from.
I had no idea.
It's a clue, you
Right.
know? And then there's incontinence. Are they jerking or stiffening? What kind of seizure is it?
All important details.
Yeah, every little thing can help paint a picture.
Okay, so let's say the seizure stops. What happens next?
Then you move on to the secondary survey.
Secondary survey.
It's where you do a head-to-toe assessment looking for any injuries that might not be obvious.
So beyond the bitten tongue,
Right, exactly. It could be anything from a fall or something internal. You really have to be thorough.
It's like putting together a puzzle, right?
Yeah, exactly.
yeah.
You're trying to get the full story.
And all this information is going to inform, what happens next.
Exactly. Like, let's take incontinence, for example.
Okay.
It comes up in both these active seizure section and the secondary survey.
Oh, interesting.
It might seem like a small thing, but it can really tell you a lot about what happened during the seizure and help guide your next steps.
I see.
It's all connected.
So, okay, you've dealt with the immediate situation. You've checked for injuries. What now?
Now you're thinking ahead, anticipating problems that might come up.
Oh, like what?
Well, for one, the airway can still be compromised,
Right, because...
from the tongue relaxing or aspiration.
Right.
And you're always on the lookout for another seizure. They can happen back to back sometimes.
Oh, gosh.
And then there's the post-ictal state.
Post-ictal?
It's that period right after a seizure. It's super unpredictable. Some people are confused. Some are combative and agitated.
Oh, wow.
It can be pretty intense.
So you really got to be ready for anything.
Absolutely. You're always one step ahead,
Wow, this has been so fascinating. I mean, it really makes you appreciate what paramedics do.
For sure. It's not easy.
So for our listeners out there, what's the big takeaway here?
I think it's understanding that seizures are a lot more complex than they seem. It's not just about stopping the shaking. It's about observation, quick thinking, and anticipation.
Yeah, and it makes you think, what can you do if you see someone having a seizure?
That's a good question to consider.
Absolutely. Well, thanks for joining us on this deep dive. And as always, stay curious.
Thanks for having me.
Okay, so today we're going to kind of dive into something pretty intense.
Yeah.
Paramedics and sexual assault.
Mm-hmm.
And, obviously it's a very sensitive topic.
For sure.
But like we always do, we're going to be looking at this, from the perspective of the guidelines
Absolutely.
and how those guidelines try to balance all these different factors.
Yeah.
So I've been, reading through some of these official guidelines for paramedics, and I got to say, like, some of this stuff really surprised me.
Oh, yeah.
I mean, it's way more complicated
Sure.
than I ever thought it would be.
Mm-hmm.
And I'm really glad that we have you here to, like, help break down all this information for us.
Absolutely happy to be here.
So, like, just from a broad perspective,
Yeah.
I was really struck by this idea of how paramedics are trying to walk this really fine line between, like, respecting the victim's wishes,
Right.
but then also making sure that, like, potential evidence is preserved.
Absolutely.
That can't be easy.
Yeah. No, it's a very tough thing to do.
So, um, I'm curious, like, when you look at these guidelines, what to you stands out as, like, the most important thing for the victim's experience?
I think one of the things that really jumps out at me is just that right away they're saying, like, you never leave this person alone.
Oh,
Never leave a patient who's reporting a sexual assault alone.
hmm.
Because think about it, you're in this incredibly vulnerable moment.
Right.
You're probably in shock. There's all this trauma.
Yeah.
And just having somebody there consistently can be so grounding.
Makes sense.
Yeah.
Yeah, just that sense of like,
Mm-hmm.
okay, I'm not alone.
Right.
Somebody's here with me.
Exactly. Somebody's here for me.
And that kind of makes me think too about situations where, the victim is particularly vulnerable
Mm-hmm.
and thinking about like children,
Right.
because the guidelines do address this specifically.
Yeah, they do.
Right.
And it shifts the focus to really understanding like a child's specific needs and vulnerabilities.
So it's not just a blanket like, okay,
Yeah.
this is what we do for everybody.
Yeah.
There are special procedures for kids.
Absolutely.
Wow.
Yeah, so like reporting the assault is different, obviously, making sure that the child is safe and that their well-being is protected,
Hmm.
and then making sure that they're connected with, special support services that are designed for children.
Yeah, because a child might not be able to advocate for themselves in the same way that an adult can.
Exactly. That's exactly right.
So it's like an extra layer of protection.
Absolutely.
Wow.
Yeah.
And this leads to something else that I thought was really interesting, and that is that the guidelines say that paramedics should offer to contact the police,
Yeah.
but then they also have to respect the patient's wishes if they don't want involves law enforcement.
Right.
I mean, that seems like such a tough situation.
It is a really difficult balance. You have to balance encouraging someone to report
Mm.
with respecting their autonomy.
Right.
And there are lots of reasons why someone might not want to involve the police. Maybe they're afraid, maybe they've had bad experiences in the past. Maybe it's a personal thing.
Right.
But it's so important that their decision is respected.
Yeah.
At the same time, you want to make sure that they know what their options are,
Mm.
and what the potential benefits of reporting might be.
Yeah.
Things like getting support services
Mm-hmm.
or even potentially taking legal action.
Right.
So it's tricky.
It's about empowering them with information
Right.
and then letting them decide what's right for them.
Absolutely.
Wow. Another thing that really stood out to me was, and this was a very specific detail,
Yeah.
it was the instruction to bag certain materials if the police request it.
Mm-hmm.
Now, why is that so important?
That comes down to preserving evidence.
Okay.
And it might not be obvious, but even things like the linen on the stretcher
Oh.
or the bandages that they use,
Mm-hmm.
those could have DNA on them.
Oh, geez, I never even thought about that.
Yeah, or other traces of what happened.
Wow.
And those can be really important for investigators.
Yeah.
So the paramedics have a crucial role in collecting and preserving those materials.
So it's like they're almost like part of the investigative team in a way.
In a way, yeah, absolutely.
It really makes you realize like how much is going on behind the scenes
Yeah, it really does.
that we just don't even think about.
Right.
And then before we wrap up, I wanted to touch on one last thing from the guidelines,
Okay.
and that's the idea of discussing local resources with the patient.
Mm-hmm.
What kind of support networks are typically available?
Well, thankfully, there's a lot out there.
Okay.
There are sexual assault crisis centers.
Mm.
There's counseling services, legal aid, advocacy groups,
Wow.
and paramedics can really help connect victims with those resources,
Yeah.
which can be so important for healing.
Yeah, that's great.
Absolutely.
Well, thank you so much for sharing your expertise with us. This has been really eye-opening.
Happy to help.
It's a complex and sensitive issue, and it's something that, most of us don't really think about very often.
Right.
And to our listeners out there, thank you for joining us on this deep dive.
Mm-hmm.
You've given us a lot to think about, and hopefully this has helped you understand, the complexities of this sensitive issue a little bit better.
Yeah.
And before we go, I just want to leave you with something to ponder.
Okay.
We've learned a lot about how paramedics try to balance respecting a victim's wishes
Mm-hmm.
and the need for evidence.
Mm-hmm.
So how might we do a better job of informing the public about these procedures?
Right.
I mean, could greater awareness help people feel more empowered to make informed decisions in what is just a really, really difficult situation.
Yeah, absolutely. That's a great question to think about.
Thanks again.
My pleasure.
All right, we'll see you next time.
See ya.
All right, so we're diving deep today into a world that's pretty intense, I think you can say that, right? The world of paramedics.
Absolutely intense, yeah. High stakes, fast paced.
Exactly.
Yeah.
And we got some really fascinating material, actually, that someone sent us. Basically digging into two really key aspects of what paramedics do that you might not immediately think of.
Right.
You know, you think about the heroics, you know. You think
Yeah.
about the rushing to the scene and the life-saving maneuvers, that kind of thing.
Yeah.
But we're going kind of behind the scenes, I guess you could say,
Mm-hmm.
and looking at documentation and equipment.
Yeah, the unsung heroes, you could say, of paramedicine, kind of like the foundation upon which everything else rests.
Exactly.
Yeah.
So we're going to really kind of unpack those two things and see why they matter so much. And to do that, we've got these two really key documents, the Ontario Ambulance Documentation Standards. I think we can just call it OADS from now on, right?
Yeah, definitely. OADS.
And then the Ambulance Call Report Completion Manual.
Mm-hmm.
So these are basically the rule books, right?
Yeah. They lay out all the things that need to be documented, every little detail, all the steps.
Yeah.
Because every piece of information, like vital sign trends, the medications they use, everything could become really important later on down the line.
Yeah, and it's interesting you say that because I was looking through these documents, and it really struck me that it's almost like a paramedic is also kind of like a legal detective in a way.
That's a great way to put it, yeah. Because the information they gather, the way they document it, it can literally be used in court cases. Like, think about a car accident. The paramedics report could be crucial evidence.
Right. Or like a slip and fall or something, you know, or anything really.
Yeah.
So what kind of things, I mean, obviously you have like the patient's name and their, you know, all that kind of stuff. But what else is in there that's maybe not so obvious?
Well, you have the clinical responses to treatments and procedures. So, like, if they give a medication, they need to document how the patient responded to that.
Got it.
And that's important for analyzing what worked, what didn't, how to improve things. Then there's also the documentation of any instances of threatened violence, which,
Hold on a sec. That's in there.
unfortunately, yeah, it's a reality of the job. It happens. And it's important to document that, both to protect the paramedics and to inform safety protocols.
Yeah, I guess you don't really think about that side of it too much, right? I mean, it's kind of unsettling to think about, but yeah, I guess it's important to have a record of that
Absolutely.
for all those reasons.
Mm-hmm.
Wow. And what about like when they have to transfer a patient from one facility to another, like from a smaller hospital to a bigger one or something?
Yeah, interfacility transfers, those are big ones. I mean, you're basically handing off a human life, right? So there's a ton of documentation involved. You have the comprehensive patient history, all the care information, transfer papers like case summaries, and even a list of the patient's belongings.
It's like a relay race where the baton contains someone's life story.
That's a great analogy.
And you can't drop it.
Exactly. You can't drop it. There's zero room for error.
Yeah, it's pretty intense.
Yeah.
Okay, so we've talked a lot about documentation, but you know, all this paperwork wouldn't mean much if you didn't have the right equipment.
Exactly. You could have the most beautifully written report in the world, but if you don't have a functioning defibrillator when you need it, it's not going to do much good.
Right.
And it's not just about having the equipment, it's about knowing how to use it properly under pressure.
Yeah. Because like a malfunctioning defibrillator or, you know, even something like an oxygen mask.
Right.
Like if it's not used correctly, that could have like really bad consequences, right?
Absolutely. It's life or death stuff. That's why the training is so rigorous.
Yeah. And I think it's said somewhere in here too that paramedics are actually obligated to report any equipment problems, right?
Oh, yeah, absolutely. They have to report any issues to their ambulance service operator immediately. You can't be rolling up to a scene with a faulty piece of equipment.
Right. It's almost like being a pilot or something. You know, they do that pre-flight check every time before they take off. It's got to make sure everything's working perfectly.
Yeah, exactly. But in this case, the stakes are even higher. It's not just about getting from point A to point B. It's about saving lives.
Exactly. So I guess what we're really seeing here is that there's this whole like hidden world of complexity to being a paramedic.
There is, yeah. A lot more goes on behind the scenes than people realize.
Right. It's not just about the rushing and the sirens and all that.
Yeah, it's about Meticulous documentation, properly used equipment, all these things that work together to ensure the best possible outcome for the patient.
Yeah. The unsung heroes of pre-hospital care, for sure. But it makes me wonder, like, with all the technology that's coming out these days, think about electronic patient care records, all that kind of stuff.
Yeah, telemedicine, remote monitoring, who knows what's next.
Right. Like, imagine having AI in the ambulance that could, like, help with diagnostics or something. That's
Yeah.
pretty wild.
It is wild, and it makes you think, what new challenges and opportunities will that bring for paramedics? How will their jobs evolve? It's a pretty fascinating question to consider.
Definitely. Definitely. So much to think about. Well, that's about all the time we have for this deep dive, but hopefully this has given you all a new appreciation for the incredible work that paramedics do every day.
Yeah, they're true heroes. And the next time you see an ambulance go by, remember that there's a whole lot more going on than meets the eye.
Exactly. Thanks for listening, everyone.
Thanks for having me.
All right, so have you ever, like, watched an ambulance speed by and just thought about, like, all the moving pieces that have to fall into place to make sure the patient gets the best care possible?
Yeah, definitely. There's a lot more going on than people probably realize.
I think so too, and that's exactly what we're diving into today. Like, the teamwork between paramedics and other healthcare pros, especially in Ontario.
Yeah, it's pretty fascinating.
So for this deep dive, we're using some guidelines from the Ministry of Health in Ontario. And, well, these guidelines, like, shed light on how paramedics work alongside other, healthcare professionals, those interactions.
Yeah, they're key, those interactions.
And we're going to focus on two main areas, like when paramedics interact with other healthcare pros on scene, and then the procedures for when they transfer a patient's care at a hospital or whatever.
Right, because those are like some of the most critical moments in emergency care.
Exactly. And so let's just jump right into it. The first thing that really caught my eye, and this is something that's, like, emphasized throughout the guidelines, is this idea of working with regulated health professionals.
Sounds pretty official, right?
It does.
So, can you break down what that actually means?
Sure. So when they say regulated health professionals, they're basically talking about anyone who's registered with their professional college in Ontario. They've got to meet certain standards to practice. So we're talking about doctors, nurses, midwives, respiratory therapists.
Oh, and like anyone else providing healthcare, right?
Yeah, exactly. Like anyone who's officially licensed to practice.
So let's say a paramedic gets to a scene and there's already a nurse there taking care of the patient. The paramedic has to, like, check that the nurse is actually a registered nurse.
Absolutely. They can't just assume. It's all about patient safety. So the paramedic has to confirm that the nurse is actually registered with the College of Nurses of Ontario and that the patient is actually under their care. Wow. Okay, so there's like a whole verification process. I mean, it makes sense, but I never really thought about it.
Oh, yeah, it's a crucial step. And, sometimes it can get a little, well, it can be a bit bureaucratic, I guess you could say.
Yeah, I can imagine, like, especially in a high-pressure situation where every second counts.
Right, but it's essential,
Yeah.
to make sure that everyone involved is qualified and authorized to provide care.
For sure.
Yeah.
Have you ever, like, been in a situation where this verification process was super important or maybe even, like, prevented something bad from happening?
Yeah, I can think of one case, actually. A bystander, he claimed to be a doctor and was, trying to give instructions at the scene. And the paramedics did exactly what they're supposed to. They verified his credentials. And, well, it turned out he wasn't actually licensed to practice in Ontario.
Oh, wow. That could have been really bad.
Yeah, it could have. And that's exactly why those checks are so important. You never know.
That's a great example, and it just shows that, like, you can't just take anyone's word for it. You got to follow the process. And so with all this verification, I'm guessing there's a ton of documentation involved too, right?
Oh, absolutely. Everything gets documented. The regulated health professional's name, their profession, what care they provided, the whole 9 yards. It's all about accountability and having a clear record of who was involved and what happened.
Makes sense. So you can, like, trace everything back. Okay, so that's the on-scene stuff. Now let's get into, like, the second part of our deep dive here, the transfer of care procedures. When a patient arrives at a hospital or a facility.
Right.
So what's the main focus there?
Communication. Clear communication, making sure that patient information gets handed over smoothly and seamlessly, like a relay race.
Got it. And looking at the guidelines, there are a lot of details they cover. Like one thing that stood out to me was providing biometric data.
Mm.
What exactly is that?
So that's stuff like the patient's fingerprints, a photograph, things like that. It may seem a little out of place.
Yeah, why fingerprints?
Well, think about it. It helps with accurate identification, especially if a patient's unconscious or can't communicate.
That makes sense.
Uh-huh.
Okay, so then there's the verbal report, which sounds like it covers pretty much everything.
Oh, yeah. It's super comprehensive. You've got patient demographics, their age, sex, all that. Their CTS score, which is the Canadian Triage and Acuity Scale score, that basically tells the receiving facility how urgent the case is. And then the chief complaint, so like why the ambulance was called in the first place.
Yeah.
And it doesn't stop there. You've got the relevant medical history, like any pre-existing conditions, allergies, medications they're on. Then there's the assessment findings from the paramedics, like vital signs, physical exam findings. And of course, we got to include what care was provided by the paramedics and how the patient responded to it.
Wow. It's like a whole story of the patient's journey so far.
That's exactly what it is.
And all that before they even get inside. That's impressive. But what about the patient's stuff? Like their belongings, medications, things like that.
Oh, yeah, definitely. That's a big part of the transfer, too. The guidelines are clear about that. It's not just about the medical stuff. It's about the whole person.
Right, like their comfort and well-being, too.
Exactly.
Now, let's talk about delays. Sometimes emergency rooms get overwhelmed. So what happens if there's a wait to transfer care?
Oh, that's unfortunately pretty common these days. But paramedics are trained for that. They become advocates for their patients. They notify the right people, the charge nurse, the attending physician, whoever's in charge, and they make sure the patient's condition is stable and that they're getting the care they need while they wait.
So they're like liaisons, too. That's a lot of responsibility.
It is, but it's part of the job.
And the final thing that I thought was really interesting was how they define a complete transfer of care. It's not just about getting the patient through the doors of the ER, right?
Nope, not at all. The transfer is only officially done when the patient is no longer depending on ambulance resources.
So paramedics are still responsible until the hospital staff fully takes over.
That's right. It's a big commitment to seeing the patient through to the end.
Yeah, I never really thought about it like that. It's a lot more than just dropping someone off. It's making sure the care continues seamlessly.
Absolutely.
Well, this has been really eye-opening. I think next time I see an ambulance, I'm going to have a whole new appreciation for the paramedics and all the work that goes into making sure patients get the care they need. It's truly a team effort, and these guidelines really highlight how crucial that teamwork is.
I agree. And it's not just about the guidelines, it's about the paramedics and the healthcare professionals who are dedicated to providing the best possible care.
That's so true. It's really inspiring to hear about their dedication. And for everyone listening, next time you see an ambulance, just remember the incredible amount of coordination and expertise that's happening behind the scenes. It really is a web of collaboration, all working together to save lives. So what do you think, how might technology play a role in making this whole process even smoother and more efficient in the future? Maybe with real-time data sharing or something like that.
Well, yeah, that's a good question. There are definitely a lot of possibilities. I mean, imagine if paramedics could transmit patient data directly to the hospital while they're en route, so the ER staff can be totally prepared even before the ambulance arrives. Or, maybe even using AI to help with triage and decision-making in those crucial first few minutes. It could really revolutionize emergency care.
That's pretty amazing to think about. Well, thanks for joining me on this deep dive. It's been a fascinating look into the world of paramedics and their crucial role in the healthcare system.
You're welcome. It was my pleasure. It's always great to shed some light on this important work.
And all our listeners, thanks for tuning in. We'll catch you on the next deep dive. Welcome back, everyone, to the deep dive. Today, we're going deep on, kind of a high-stakes topic, paramedic decision-making in Ontario.
Yeah, definitely high stakes.
We got a ton of requests from you all to really dig into how paramedics handle those tough calls, about treatment, about transport, especially when a patient's saying, no way, I don't want help.
Right. Yeah, it's fascinating, isn't it? Like, where does patient autonomy meet, the need for care, potentially life-saving care?
Absolutely. And luckily, we've got some pretty detailed guidelines from Ontario that lay out the framework, like the legal and ethical side of all this.
That's what we'll be unpacking today.
Okay, so one thing that jumps out right away from these guidelines is this huge emphasis on a patient's capacity to make decisions. They even have this aid to capacity assessment tool, which sounds pretty official.
Yeah, it's all about figuring out if the patient truly gets what's going on. Do they understand the situation, the potential consequences if they refuse care, and can they actually communicate their decision clearly?
So it's not just like, are they conscious, yes or no? There's more to it.
Way more. And the interesting thing is, capacity isn't always black and white. It can change. Especially in those emergency situations, things can be really fluid.
Oh, for sure. Can you give an example? Like, how could that change so fast?
Absolutely. Imagine someone's had a head injury, right? At first, they seem totally lucid, answering your questions, making sense. But then as their condition changes, their ability to make, sound decisions, it can deteriorate really quickly.
So, like, what seemed like a refusal 5 minutes ago might not be valid anymore.
Exactly.
Okay, so let's say someone does seem totally capable, they understand what's going on, but they flat out refuse help. To me, that's counterintuitive. Like, shouldn't paramedics intervene if someone needs it?
Yeah, it's tough, but it comes down to medical ethics, the big one. Respecting patient autonomy. If someone gets the risks and still refuses, you can't force them.
But I bet there's a process here. It can't be as simple as, you don't want help? Okay, see ya.
No way. Paramedics have a very clear set of steps. They got to inform the patient about those risks, make sure they understand, and advise them, hey, if anything changes, call us back. And of course, document everything.
Documentation, that's got to be key. Like a safeguard for everyone involved.
Totally. Protects the patient, protects the paramedics. It's interesting that there's no law saying the patient has to sign a refusal.
Huh.
Didn't know that.
Yeah, but that documentation from the paramedics, crucial. Now let's get into the more, I guess you could say, intense stuff. Those situations where consent isn't needed. The guidelines call it emergency treatment and transport without consent.
Ooh, yeah, those sections definitely caught my eye. Sounds pretty heavy. So there are two main scenarios where this comes up.
Right. First one, if the patient clearly can't make an informed decision, they might be unconscious or have a really severe condition, something like that.
Okay, that makes sense. What's the second one? When you just can't communicate to get consent. Even though the patient might be capable, there's a barrier there. But the common thread, in both cases, imminent danger.
Imminent danger. That's serious. What are we talking about here?
Think uncontrolled bleeding, someone struggling to breathe, signs of a stroke. Every second counts. The guidelines use terms like severe suffering or serious bodily harm. Basically, if action isn't taken immediately, there's a serious risk to the patient's life or well-being.
Wow. So in those moments, it's about doing what's best for the patient, even if they can't tell you what they want.
Exactly. But the bar for overriding consent, it's high. Paramedics need a rock-solid reason, and they got to be ready to back it up with that detailed documentation. This is where experience and judgment really come into play.
I was also noticing the guidelines specifically call out language barriers and disabilities as, potential roadblocks to communication. It's got to be crucial to make sure care is inclusive.
Absolutely. Paramedics are expected to make every reasonable effort to communicate, whether it's interpreters, assistive devices, or getting creative, But if those efforts are going to cause a delay, and that delay puts the patient at risk, action takes priority.
So it's like this constant balancing act, clear communication versus the urgency of this situation.
Definitely. It's nuanced, it's complex. Ultimately, paramedics are trained to look at each situation, assess it, and make the best possible call for that patient's well-being.
This has been a fascinating deep dive. It really shows how much goes into paramedic decision-making. It's not just medical skills. It's ethics, communication, judgment calls under pressure.
And don't forget, these guidelines, they're just a framework, Every situation is different. Paramedics bring their training, their experience, their compassion to make those tough choices in, some really challenging circumstances.
You've given us a lot to think about. So, listeners, I want to leave you with this. What factors do you think should matter most in those life or death situations? Something to ponder. Thanks for joining us on the deep dive. Okay, so today we're going deep on something pretty interesting.
Okay.
It's all about how paramedics are trained to assess children in emergencies.
Interesting.
Yeah, and we're looking at these guidelines called the General Pediatric Standard. And even if, like most of us listening, aren't paramedics,
Right.
it's still pretty fascinating to see how they approach these situations because kids are so different from adults. Medically speaking.
Oh, yeah, absolutely. I mean, you can't just treat a kid like a small adult. Really.
Whoa, not at all.
Their bodies work differently.
Totally. And these guidelines really highlight that from the get-go.
Yeah.
Like, for example, we always hear about cardiac arrest being like the big scary thing, right?
Yeah.
But with kids, it's actually respiratory arrest.
Yeah.
That's the main thing that leads to cardiac arrest.
That's a really important point, and it kind of flips everything on its head, right?
Yeah, totally got it.
Like in adults, we're so focused on the heart.
Right.
But in kids, it's all about the airway.
So why is that?
Well, there are a couple of reasons.
Okay.
First off, kids have much smaller airways than adults.
Okay.
So they're way more easily obstructed, by things like mucus or a foreign object.
Oh, I see.
And then on top of that, their metabolic rate is like way higher than adults.
Which means?
Which means they burn through oxygen much faster.
Oh, wow.
So if their breathing is compromised for whatever reason,
Yeah.
they can crash really quickly, much faster than an adult would.
Oh, gosh, that's so scary.
Yeah.
It really makes you realize how crucial airway management is in these situations.
Absolutely, every second counts.
And it's not just the airway, right?
No, not at all.
There's like a whole bunch of other signs that paramedics are trained to look for in kids.
Right.
Things that, most of us would probably just brush off.
Exactly. You wouldn't necessarily think they were red flags.
Right. Okay, so give me some examples.
So like a sudden change in appetite,
Okay.
inconsolable crying, or even like a decrease in wet dieters. Yeah, these can actually be early warning signs of some pretty serious conditions.
I'm trying to picture that. So like say a baby suddenly refuses to breastfeed.
Right.
What could that indicate?
Well, it could be a sign that they're having trouble breathing, which makes it hard to suck and swallow.
Okay.
Or it could be something like an ear infection, where it hurts when they try to lash on.
Oh, that makes sense.
And then the inconsolable crying you mentioned, that could be a sign of pain fever or even like a neurological issue.
Wow. It's like you need a secret decoder ring to figure out what these little ones are trying to tell us.
Pretty much. And the guidelines really emphasize that you have to be super observant.
Yeah.
It's not just about checking vital signs. You have to really notice those subtle behavioral shifts.
That's interesting.
Yeah, because those can be clues to a bigger problem.
Okay, so speaking of observation,
Yeah.
there's this thing in the guidelines about the toe-to-head approach for examining infants and children.
Oh, yeah.
And that seems so counterintuitive to me.
I know, right?
Like, I feel like I would always want to check their face and eyes first.
It's funny because you'd think you'd want to see, like, if they're making eye contact and stuff.
Exactly.
But there's a good reason for starting at the toes.
Okay, I'm all ears.
So think about it from the child's perspective, right?
Mm-hmm.
This stranger's coming at them, maybe with all these weird instruments.
Yeah, that's scary.
By starting at the feet, the paramedic can, examine the least invasive areas first,
Okay.
and then slowly work their way up, building trust with the child before they get to the more sensitive areas like the head and face.
Oh, that's smart. It's all about minimizing distress and making the whole experience less scary.
Exactly. It's really interesting how much psychology goes into this stuff.
It really is. And speaking of the head,
Yeah.
there's a specific instruction about assessing something called fontanelles in infants.
Oh, right. Fontanelles.
And to be honest, I'm a little fuzzy on what those are.
Oh, yeah. So fontanelles are those soft spots on a baby's head.
Oh, okay.
The ones that kind of make you nervous to touch.
Yeah.
So they're totally normal. It's just how baby skulls are formed.
Okay.
They basically allow space for the brain to grow.
Makes sense.
But changes in how they look, like if they're sunken in or bulging out,
Yeah.
that can actually tell us a lot.
Like what?
So like a sunken fontanelle could mean the baby's dehydrated,
Okay.
and a bulging fontanelle could mean there's increased intracranial pressure.
Intracranial pressure.
Yeah, that's basically the pressure inside the skull.
Gotcha. And those are both serious.
Right,
Okay.
definitely those need immediate attention.
It's amazing how much you can learn from just looking at those little soft spots.
It is, isn't it?
Yeah. It really drives home the point that children are not just miniature adults.
No, they're not.
They have their own unique physiology,
Yeah.
and you have to approach their care in a totally different way.
Exactly. And you know what's really cool about these guidelines is that
Okay.
even though they're super detailed and comprehensive,
Yeah.
they're really just the tip of the iceberg.
You mean there's even more to it?
Oh, yeah. Paramedics have to know so much more to be able to assess and treat children effectively.
Well, I have to say, after this deep dive, I have a whole new level of respect for what they do.
It's pretty incredible.
And it makes you think, what other subtle signs might we be missing in our own kids?
Oh, yeah, definitely.
Like maybe a change in how they walk or how they're holding their arm or something.
Right.
It really makes you want to pay closer attention and maybe even do a little more research.
Yeah, knowledge is power, especially when it comes to kids.
Absolutely, because, being informed can literally make all the difference.
Couldn't agree more.
So, yeah, it's something to think about.
Definitely.
Thanks for listening, everybody.
Yeah, thanks for having me. This was fun.
All right, till next time.
See ya.
Bye.
Bye.
All right, buckle up, everyone, because today we're diving deep into the world of patient transport.
Yeah.
We got our hands on
Some juicy sections.
some really interesting sections, actually, from a paramedic standard document.
It's a big one.
And we're going to try and break down how these guidelines actually impact the decisions that paramedics are making every single day.
Yeah, I mean, this document, this isn't like light reading.
No.
It's like, this is the rule book that helps paramedics make those like really critical split-second decisions out there in the field.
And it's so interesting because, when we see an ambulance go by, we kind of just think like, oh, someone's going to the hospital.
Yeah.
But there's so much more to it.
So much more.
And this document, I think, kind of helps us get into that thought process behind choosing where a patient goes and what can even cause that decision to change mid-transport, which I think is super fascinating.
Yeah, and that's where I think something like the Canadian Triage and Acuity Scale, or CTS, really comes in.
CTS levels, yeah.
So important.
These are essential, right?
Right. Imagine you have somebody that's in cardiac arrest.
Oh, wow.
That's a CTAS 1 situation.
Okay.
The most critical
Yeah.
time is truly of the essence.
Got it.
And then you have CTAS 5, which could be, you sprained your ankle.
Right, right.
So, each of these levels really help the paramedics kind of determine, how urgent a situation is.
So let's picture this, right? So the paramedic is on scene. They've assessed the patient. They've figured out, okay, this person's a CTAS whatever level.
Right.
What happens next?
So ideally what happens is they're communicating with their ambulance communications officer,
Okay.
the ACO.
Okay.
And the ACO kind of helps guide them, helps them decide, what's the best facility to take this patient to. But sometimes that's not possible. Communication isn't always possible.
Right.
So that's when, the paramedic has to use their judgment.
And this is where it gets really interesting, right? Because the document talks about choosing the closest or most appropriate hospital.
Yes.
So can you walk us through an example where maybe a paramedic would choose a hospital that's further away?
Yeah, absolutely. I mean, think about a patient with a severe spinal injury.
Okay.
In that case, getting them to a specialized trauma center is absolutely critical, even if it means bypassing a closer general hospital, because that specialized care, even if it takes a little bit longer to get there, could significantly impact their outcome.
Makes sense.
Right.
Absolutely. And beyond the where, the document also emphasizes gathering all of the patient's medication information. Why is that so crucial?
Oh, it's about ensuring this really smooth handoff of care.
Okay.
Let's say you have a patient that's on blood thinners.
Oh. Yeah.
Knowing that immediately helps the hospital team make the best decisions, right?
Yeah.
About their treatment, and it can help prevent potential complications.
So it could be a real lifesaver.
Absolutely.
And sometimes that care needs to continue at a different facility altogether. What can you tell us about these interfacility transfers?
So interfacility transfers are basically, when a patient needs to be moved from one hospital to another, maybe for a specialized procedure or just a higher level of care.
Okay.
And the document really emphasizes the specific information that paramedics need to gather, like details about the sending physician, is there any transfer paperwork, current treatment orders?
Oh, wow.
It's all about minimizing delays and ensuring, again, that continuity of care.
So for you, what really stood out about these guidelines for transfers?
I think for me, what stood out was just how these transfers can be really complex.
Yeah.
So having that detailed information up front is really, really important to help the receiving hospital prepare.
Right.
And it also really helps prevent any miscommunication
Oh, for sure.
that could, again, impact the patient's care.
Right.
So it's all about just clear communication, throughout this whole process.
Absolutely. So important. Now, going back to the transport itself,
Yeah.
the document's actually pretty specific about how to transport patients based on their CTAS level. What are some of the key points there?
Right. Well, for the most critical cases, like our CTAS 1 and 2, it's very clear-cut.
Okay.
Stretcher transport every time.
Okay.
I mean, these are situations like our cardiac arrest example where every second counts, right?
Makes sense.
But then when you start getting into, CTAS levels 3 to 5, there's a bit more flexibility.
Okay.
So like a CTAS 3 might be somebody who has a broken arm.
Got it.
In those cases, paramedics can assess whether, a lift or carry is appropriate, or even if the patient can walk safely.
Right.
It's all about patient comfort and, of course, safety being the top priority.
Right. And I think it's interesting, too, because even if you have, let's say a medical escort on board, the paramedic is still ultimately responsible
Always.
for that patient's well-being during the transport.
Yep.
Why is that so important?
Well, it just really speaks to the level of training and expertise that a paramedic has.
Yeah.
They're not just like drivers,
Uh-huh.
they're medical professionals making these really crucial decisions on the fly.
Yeah.
They need to be prepared for anything.
And sometimes those decisions need to change mid-route.
Absolutely.
And the document actually talks about what happens if a patient's condition, deteriorates.
Yeah, it's all about
What could happen?
it's about that communication and that quick thinking.
Yeah,
Right.
totally.
So if a patient, let's say, suddenly worsens and the original destination isn't suitable anymore, the paramedic might have to divert to the nearest appropriate hospital.
It just makes you realize, they're constantly under pressure
Huge pressure.
to, adapt to changing circumstances.
No, absolutely. And the document actually, it goes beyond just medical procedures.
Right.
It even addresses things like, maintaining a comfortable temperature in the ambulance, having proper lighting.
It's interesting how those, seemingly small things are actually part of a larger standard of care.
Exactly. It's about a holistic approach.
Yeah.
A calm and comfortable environment, that can actually make a real difference for somebody that's going through this,
Totally.
medical emergency. It's a
Yeah.
stressful thing.
So big picture, what is this deep dive telling us? We've seen how patient transport is this carefully planned process, right?
Right.
With these standards in place to help guide paramedics in making, the best possible decisions.
Absolutely. And I think this document really highlights, the level of responsibility and expertise required of paramedics.
Oh, yeah.
I mean, they are making potentially life-saving decisions every single day.
It's pretty remarkable. And, this document gives us a glimpse into the protocols, but imagine the real-life experiences behind these guidelines. The paramedics who've had to, make those tough calls, the patients whose lives have been touched by these decisions. It just really makes you think about the human impact of this, really essential part of our healthcare system.
Absolutely. Couldn't have said it better myself.
Well, that's all the time we have for today's deep dive, but thanks for joining us.
Until next time. All right, welcome back, everyone, to the deep dive. Today, we're diving into something a little different.
Oh, are we?
Yeah, we're going to be looking at excerpts from a paramedic training manual.
Interesting.
Yeah, so we're going to get a glimpse into how these first responders, how they approach trauma situations, and I think there's a lot we can learn, even for those of us who aren't, medical professionals.
Absolutely.
So, have you ever wondered what goes through a paramedic's mind when they show up at a scene?
I mean, it's got to be a million things at once, right?
Yeah, right. Well, we're about to find out.
Let's do it.
So one of the first things that really jumped out at me from this manual is this idea of trauma standard. They have this very systematic approach to assessment and care.
It's fascinating, right? They have these steps that they go through, and they emphasize immobilizing the patient right away.
Especially if there's any suspicion of a spinal injury.
Right.
Right.
I mean, even the slightest movement could make things worse. So protecting the spine is really crucial.
And that's where SMR comes in, spinal motion restriction.
Exactly. They stabilize the spine before they even think about moving the patient.
And it's kind of like, have you ever played Jenga?
Oh, yeah.
It's like that. One wrong move.
The whole thing could come crashing down.
Exactly.
So then they have to decide, whether to extricate the patient or not.
Oh, yeah. To move them or not.
Yeah. Can you imagine, being in that situation, you had to decide right there on the spot?
That's a tough one.
Yeah. Is it safer to move them from, a wrecked car or whatever it is? Or is it better to leave them where they are?
Right. And the manual is very specific. It says that, extrication should only happen if the scene is safe.
Right. And if there's an immediate danger to the patient.
Or if they need some kind of intervention that can't be done, right there on site. So it's this balance.
It's a judgment call, for sure.
Definitely. And once they've kind of addressed those immediate concerns, they move on to what they call a rapid trauma survey.
Okay, so this is more than just your basic ABCs, right?
This is going beyond that, looking at the whole situation and figuring out what needs to be done first. What are the most urgent things?
And that includes things like estimating blood loss.
Yeah.
Right.
Yeah. How do they even do that in the field? I mean, that seems
It's tough.
really hard.
Yeah. They're looking at flow rate, the presence of clots, even, how much blood has soaked into clothing or anything around the patient.
Wow.
It's a lot to take in.
Yeah. All right, here's a scenario. I always get kind of like freaked out when I think about this. Impaled objects.
Oh, yeah.
Do they try to remove it right away?
You would think so, but actually, no.
Yeah.
The manual very specifically says, do not remove it unless it's absolutely necessary.
Whoa, really? Why not?
So think about it. As scary as it looks, that object could be like acting as a plug, stopping the bleeding. And if you pull it out, who knows what's going to happen?
That's a good point.
You could do more harm than good.
Right. Are there exceptions to that, though? Like, what if it's blocking their airway?
Right. Yeah. Of course, there are exceptions. If it's like a life or death situation, then, they got to remove it. And sometimes they even have to shorten the object to make it safe for transport.
Oh, wow. Can you imagine having to make that call?
That's a tough one.
Yeah. So after all of those, immediate life or death concerns, they move into a more detailed injury assessment.
So they really go through everything.
Yeah, they have this mnemonic they use. KLAPSPDS.
KLAPSPDS.
Yeah, I know, it sounds crazy. But it helps them remember all the things to check for. Contusions, lacerations, abrasions, punctures or penetrations, swelling, sucking wounds, subcutaneous emphysema, distension, deformity, and dried blood.
Wow, that's a mouthful.
It is, right. But I mean, it makes sense. You're in this chaotic situation and you need a system to keep you focused.
Right, so you don't miss anything.
Exactly. And it's not just about looking either. They also use palpation, which is basically, feeling with their hands.
Oh, okay. So they're feeling for things that they might not be able to see.
Right, like tenderness or instability or deformities. It's really another layer of assessment.
They're being very thorough.
Absolutely. And that thoroughness also applies to what they call a secondary survey.
Okay, what's that?
So if there's any suspicion of major trauma, they'll do a complete head-to-toe exam, like listening to the lungs, checking the abdomen, all of that.
They really leave no stone unturned.
It's pretty impressive. So even if, there's a very obvious, like, broken leg, for example, they're not just focused on that one injury. They're thinking about, okay, could there be other hidden issues?
Right.
Could there be, like, associated injuries to other parts of the body?
They're thinking about the big picture.
Yeah, they really are. And they also take into account, like, any clothing or jewelry that might be, compromising the injury site.
Of course, yeah, that makes sense.
But they also do it in a way that's sensitive and respectful, thinking about the patient's dignity and privacy.
Yeah, that's important. It's all about the patient, right?
Absolutely. And speaking of prioritizing vital structures, we got to talk about splinting guidelines.
Okay, so this is how they stabilize those injuries.
It's right. So one thing that kind of surprised me is that they don't automatically remove any existing dressings or splints.
Oh, really?
Yeah, if it's done right, they leave it alone.
Interesting.
They don't want to cause any unnecessary movement or potentially make things worse. But they do have a very specific order for applying splints. It's like, okay, spine first.
That makes sense.
Then the pelvis, then femurs. There's this hierarchy of protection.
They're going from the most critical areas outward.
Exactly. And this meticulousness, it really comes into play when you start talking about trauma and pregnancy.
Oh, wow. Yeah, that's a whole other level of complexity.
Definitely. And the manual actually points out this unfortunate connection.
What's that?
Between trauma in pregnant patients and domestic violence.
Oh, wow. Yeah, that's really sad.
It is. And beyond, the social aspects, there are also all these physiological changes during pregnancy.
Right.
That can actually mask the signs of shock.
So it's harder to tell what's going on.
Yeah, it's not as straightforward.
Mm-hmm.
And the manual emphasizes that that shock in pregnant patients, it can be much more subtle and it can progress really quickly.
So the stakes are even higher.
Definitely, yeah, for both the mother and the fetus. And on top of that, you have the enlarged uterus itself, which is, much more prone to injury and bleeding.
Yeah, that makes sense. So even something like blunt trauma, which you might think of as, not that serious.
Right.
It can have really serious consequences.
It can. We're talking premature labor, placental abruption, even organ rupture.
Wow.
It's really a whole different ballgame. And the manual really stresses that even like seemingly minor blunt trauma, it can lead to placental abruption. And sometimes this can happen hours after the initial incident.
That's scary.
Yeah.
So they really have to be on the lookout for that.
They do, and they have to monitor these patients very carefully, even if they seem stable at first.
Right, because things can change so quickly.
Exactly. And when it comes to blunt abdominal trauma in pregnant patients, they emphasize observing for abdominal or uterine enlargement.
Okay, so those are signs that something more serious might be going on.
Right. It's incredible how much information these paramedics have to process and how quickly they have to make decisions.
Yeah, I mean, they're dealing with like life and death situations.
And sometimes they have very limited information to go on.
It's amazing what they do.
It really is. This manual has really opened my eyes to, the intricate world of trauma response
Yeah.
and how much expertise it really involves.
It's not just treating injuries, it's so much more than that.
Yeah. And we've only just scratched the surface here. There's so much more to unpack.
Well, I can't wait to dive in deeper.
Me too. So stay with us.
It's remarkable how they're trained to handle not just the physical trauma, but also like the emotional and psychological impact of these situations.
Oh, yeah, absolutely. The manual talks about that, especially in cases of domestic violence, emphasizing the need for sensitivity and support. It's not just about fixing the physical injuries. It's
the whole person.
Yeah, the whole person, exactly. And that brings us to another really important point. They often have to make these judgment calls.
Based on like incomplete information.
Based on, incomplete information, and things are always changing,
It's not like they have a script for every situation.
No, they have to constantly be evaluating, adapting, making decisions on the fly.
Right.
And the manual, it actually uses phrases like use your judgment or if indicated,
So they have this framework, but they also have to be able to think for themselves.
They do.
Like deviate from the protocol if they need to.
And that takes a lot of expertise and confidence.
Yeah, especially under pressure.
Especially under pressure, right? That's something that's really struck me throughout this whole deep dive.
Me too. It's not just about knowing the procedures. It's like understanding the principles behind them.
The why.
The why, exactly. Like, remember that thing about not removing impaled objects?
Oh, yeah, that was a little mind-blowing.
It seems counterintuitive, right?
Yeah.
But when you understand the reasoning behind it, it makes perfect sense.
Yeah.
You could actually make things worse by trying to remove the object.
Right. It's all about, minimizing the risk.
Exactly.
This deep dive has really challenged some of my assumptions.
Oh, yeah.
Yeah, about emergency medicine and just how complex it really is. It's not just about memorizing steps. It's about really understanding the human body.
And how to respond to it in a crisis.
Exactly. And I think, even if we're not medical professionals,
Right.
there's still a lot we can learn from this, like recognizing the signs of shock or knowing, the importance of immobilizing a potential spinal injury. I mean, those are things that anyone can learn.
Yeah, absolutely. That knowledge could actually save someone's life.
It could. So it's all about, being informed and prepared.
Right, because in an emergency, those split-second decisions, that knowledge you have, it could make all the difference.
That's a really powerful thought. So as we kind of wrap up this fascinating deep dive into the world of trauma response, what stands out to you as the most impactful takeaway?
For me, it's just this reminder that even in the most chaotic, high-pressure situations, there's a method, there's a process, there's a way of thinking that can guide our actions.
And help us make the best possible decisions,
Yeah.
even when, everything around us feels like it's falling apart.
Right. And that framework, it's not just for paramedics.
Wow.
It's something we can all apply in our own lives.
Mm-hmm. Whether it's a medical emergency or any other challenging situation.
It's about having a plan, knowing the steps to take, trusting our ability to handle whatever comes our way.
And never underestimating the power of knowledge.
Right. Even a basic understanding of these principles can make us feel more, confident and prepared to face the unexpected.
It's about, empowering ourselves to be the best possible help we can be in any situation.
This whole deep dive has given me a newfound respect for the work that paramedics do every day. I mean, they're true heroes.
They are.
They face these unimaginable challenges with skill and compassion
Yeah.
and dedication.
And they're a constant reminder that even in the face of adversity, there's always hope. There's always a chance for healing.
And a reason to keep fighting.
Absolutely.
Yeah.
So on that inspiring note, I think it's time to wrap up this episode.
I agree. We've covered a lot of ground today.
We have, from the really detailed trauma assessment stuff to these broader ideas about, knowledge and preparedness.
And I hope our listeners have gotten something out of it.
I hope so too. A deeper understanding of what trauma response really involves.
And what it takes to be a first responder.
So thank you all for joining us on this deep dive. We hope you found it enlightening and maybe even a little bit empowering.
Knowledge is most valuable when it's shared.
Absolutely.
So take what you've learned today and spread the word. Be prepared to make a difference. You never know when it might come in handy.
And on that note, we'll leave you with one final thought to ponder. How can you use this knowledge, the stuff we talked about today, to make a positive impact in your own life and in the lives of those around you?
Think about it, share it, and let's keep the conversation going.
Until next time, stay curious, stay informed.
And stay safe. It's amazing how much emphasis they put on, judgment and being able to adapt in these situations.
It's not just about following a checklist, is it?
Right. They have to be thinking on their feet the whole time, weighing risks, making these split-second decisions based on what they're seeing.
And the manual, it actually uses phrases like use your judgment and if indicated.
Yeah.
It's like they're acknowledging that every situation is different.
Right. There's no one-size-fits-all answer in trauma response.
Exactly.
It's almost like they're like detectives or something.
Oh, yeah.
Yeah. They're piecing together these clues,
right.
trying to figure out what happened and what to do about it.
And they're doing all of this, under pressure.
Oh, yeah.
With lives on the line. It's incredible.
Talk about a high-stress job,
right? And it just highlights, the expertise, the critical thinking skills that these first responders have to have.
It's not just about knowing how to bandage a wound or set a bone.
Right.
They have to be able to think critically and adapt to these constantly changing situations.
Yeah, and they have to be able to deviate from the protocol if they need to, which is,
That's a big deal.
It is.
It takes a lot of courage.
It does.
And confidence in their own knowledge.
Right. Exactly. And that's what makes this whole deep dive so fascinating.
It is.
It's not just about learning, facts and figures. It's about really getting a new perspective on how complex this whole world is.
The world of trauma response. And I think, even if we're not paramedics or doctors or nurses or whatever, we can still take something away from this, like the ability to think critically. And to be adaptable.
To trust our own judgment.
Exactly. Those are valuable skills in any situation.
Absolutely. Whether you're dealing with a medical emergency or just a challenging situation in your everyday life.
It's about being resourceful, being resilient, being able to handle whatever comes your way. And, honestly, this deep dive has really given me a newfound respect for paramedics. I mean, they're out there facing these incredibly difficult situations every single day.
And they're doing it with skill and compassion.
And such dedication.
They're really true heroes, aren't they?
They are.
And they're a constant reminder that even when things are really tough, there's always hope.
There's always a chance for healing, a reason to keep fighting.
Absolutely.
Well, on that note, I think it's probably time to wrap up this episode.
Yeah, I think so too. It's been a really thought-provoking journey, exploring this whole world of trauma response and the incredible work that these paramedics do.
They are amazing, and I hope our listeners, they've learned something from this, that they have a new appreciation for what these everyday heroes do.
Me too, absolutely. And remember, knowledge is power, right? So share what you've learned, spread the word, and just be prepared to make a difference, because you never know when you might need to use this.
That's right. And until next time,
stay curious.
Stay informed.
And stay safe.
Okay, so today we're diving into a world that's crucial, but often overlooked, I think.
Yeah.
Protecting children.
Yeah.
We're going to explore this through the lens of paramedics and what they see on the front lines.
Yeah, for sure.
Our source material is Ontario's Child in Need of Protection Standard.
Okay.
And believe me, even if you're not in healthcare, what you learn here could help you spot danger signs and act responsibly to help a child at risk.
For sure. It's about connecting the dots, really.
Yep.
Paramedics walk into homes often during intense situations and get a glimpse into family dynamics that others might miss.
So it's not just about bandages and blood pressure.
Right.
It's about reading between the lines.
Exactly.
What exactly are paramedics looking for when they suspect a child might be in need of protection?
Yeah.
What does that even mean legally?
So imagine this. A situation where a child's safety and well-being are seriously threatened.
Okay.
That's the essence of what in need of protection means legally. It boils down to abuse and neglect.
Right.
And anyone, not just professionals, who suspects this is happening has a legal duty to report it to the Children's Aid Society.
Wow.
Yeah. It's not about being 100% certain.
Right.
It's about acting on reasonable concern for a child's welfare.
So it's like that saying, see something, say something, but with a legal backbone.
Yeah, exactly.
Now let's get into the nitty-gritty.
Okay.
What are some red flags that paramedics are trained to spot?
Yeah.
I imagine certain types of injuries
Right.
automatically raise suspicion.
Absolutely. Think about injuries that don't match a child's developmental stage.
Oh,
A 6-month-old with a broken leg from rolling off the couch, that would raise serious questions.
yeah.
Same with injuries that don't fit the story.
Okay.
A parent says their toddler fell down the stairs,
Yeah.
but the child has bruises all over their body
Oh, my gosh.
in places you wouldn't expect from a simple fall.
That chills me to the bone.
Yeah.
And the environment itself.
Right.
The home.
Can be a red flag, right?
Exactly. Imagine walking into a home and being hit with a wave of chaos.
No way.
Things are dirty, furniture is overturned.
Yeah.
There might even be signs of violence or animal abuse.
Oh, wow.
These are all pieces of a puzzle that could indicate neglect.
Okay.
Neglect isn't always obvious.
Right.
Sometimes it's a lingering smell,
Yeah.
a child who's consistently hungry, or a sense that they're emotionally starved for attention.
Wow. Those are details that most people probably wouldn't even notice.
Right.
Now, the document we're looking at goes into great detail about specific physical signs,
Okay.
bruises, burns.
Yeah.
It's a lot to take in.
It is. Yeah.
What are some of the key things paramedics focus on?
Location is key.
Okay.
Bruises on the chest, abdomen, genitals, or buttocks are unusual
Right.
and worrisome.
Yeah.
Same for burns of buttocks, genitals, soles of the feet.
Right.
Those areas aren't typically accidentally injured.
Yeah.
Then there are the patterns.
Okay.
A belt buckle mark, a handprint, or even a cigarette burn. Oh my goodness.
Those paint a grim picture.
Yeah.
And it's not just the presence of these signs, but also their consistency with the explanation given.
Okay.
If the story doesn't add up,
Yeah.
that's a major red flag.
It's heartbreaking but necessary to talk about this.
I agree.
What about shaking syndrome?
Yeah.
That term alone sends shivers down my spine.
It's one of the most severe forms of abuse.
Right.
Shaking a baby can cause brain damage
Oh gosh.
or even death.
Wow.
Paramedics are trained to look for hemorrhages in the eyes,
Okay.
marks on the neck, upper arms or shoulders,
Yeah.
and head injuries that don't align with the story they're being told.
So while providing medical care, paramedics are also piecing together a complex puzzle of observations and information.
Exactly.
What about the way parents or caregivers interact with the child and each other?
Right.
Are there behavioral cues that stand out?
Imagine witnessing a scene where the child is clinging to one parent while desperately avoiding the other. Or a parent is openly hostile towards the child or the other parent.
Wow.
Those are huge red flags.
Yeah.
And then there's the heartbreaking phenomenon where a child might actually try to protect their abuser.
That seems counterintuitive.
It is.
Why would a child protect someone who is hurting them?
It's complex.
Yeah.
Sometimes it's out of fear, loyalty, or they've been threatened.
Right.
Imagine being a child in a world where your abuser is also the person you depend on for everything.
Yeah.
It's a terrifying and confusing reality.
That puts things in a whole new perspective.
It does.
So a child's denial doesn't necessarily mean abuse isn't happening.
Exactly.
It often means the situation is even more complex
Right.
and demands careful attention.
Yes.
We've talked about all these potential warning signs. What happens next?
Yeah.
What does a paramedic do if they suspect a child is being abused?
First and foremost,
Okay.
they ensure the child is safe and not left alone with the potential abuser.
Okay.
If there's immediate danger, they'll request police assistance.
So things can escalate pretty quickly.
They can.
Wow.
But remember, the paramedic's priority is always the child's safety.
Right.
While they're waiting for the police, they'll try to get a clear picture of what happened,
Okay.
listening carefully for inconsistencies or anything that doesn't add up in the parent's explanation.
I imagine that it takes a lot of skill
Yeah.
to gather information without making the parents feel
Yeah.
accused or defensive.
Absolutely.
Yeah.
And it's crucial that they don't make any accusations or comments about their suspicions in front of anyone
Okay.
that could jeopardize the investigation or put the child at further risk.
Okay. So the scene is secured information is gathered.
Right.
What happens to the child?
In all cases where abuse is suspected, the child is transported to the hospital for a thorough examination
Right.
by a medical professional trained to spot signs of abuse.
Right.
And of course, the reporting process continues from there.
This brings up the legal and ethical considerations
Yeah.
of mandatory reporting.
For sure.
How seriously is that duty taken?
It's taken very seriously.
Okay.
The duty to report overrides any other provincial laws, even privacy laws.
So even if a parent begs the paramedic not to say anything,
Yeah,
they're legally obligated to report their concerns.
they are.
And failing to do so is an offense.
Yes.
It's a huge responsibility,
Yes.
knowing you might be breaking confidentiality,
Right.
possibly tearing a family apart.
Yeah,
But that's the weight of this duty.
exactly.
Wow. It really emphasizes that this is about much more than just observing physical signs. It's about navigating a complex web of legal and ethical responsibilities.
For sure.
It's a lot to process, but incredibly important.
Absolutely.
It highlights the crucial role paramedics play as advocates for children.
Yeah, I agree.
This has been an eye-opening look into the world of child protection from a paramedic's perspective. We've covered a lot of ground, but there's so much more to explore. After a quick break, we'll come back and delve deeper into what this all means for you, the listener,
Okay.
and what we can all do to protect the most vulnerable members of our society.
Sounds good.
We've been focusing on what paramedics see and do,
Right.
but I think it's time to shift gears and talk about what this all means
Yeah.
for the everyday listener.
Okay.
We may not have the same training as a paramedic,
Right.
but does that mean we have less responsibility when it comes to protecting children?
Not at all. Think of it this way. Paramedics are often responding to a situation that's already escalated,
Okay,
but we, as members of the community,
right,
might be in a position to notice those early warning signs,
right.
the subtle shifts in a child's behavior or a family's dynamic that could indicate a problem brewing.
So it's like we're all part of a safety net,
Yeah,
and the more aware we are, the
exactly.
stronger that net becomes.
For sure. And
But-
sometimes just being present and observant can make a difference. Imagine you're at the park and you see a parent being overly harsh
Yeah.
or dismissive with their child.
Okay.
Maybe the child is withdrawn and flinches at every loud sound.
Right.
Those could be signs of emotional abuse,
Okay.
which can be just as damaging as physical abuse.
That's a point I think a lot of people miss.
Mm-hmm.
We tend to focus on the visible signs of abuse,
Right.
but emotional abuse can leave deep, invisible scars.
It absolutely can.
Wow.
It's like chipping away at a child's self-esteem and sense of worth bit by bit.
Yeah.
And the thing is, emotional abuse often goes hand in hand with other forms of abuse.
Okay.
It's rarely an isolated issue.
So what do we do if we see something that troubles us?
Yeah.
It's easy to feel hesitant
Yeah.
to think, oh, it's probably nothing, or
Yeah.
I don't want to get involved.
That's right.
But what if we're wrong?
That's the risk we can't afford to take.
Okay.
It's always better to err on the side of caution when it comes to a child's safety.
Right.
Even if you're not certain,
Uh-huh.
trust your gut feeling.
Okay.
If something feels off, report it to the authorities.
Mm-hmm.
Your call could be the one that changes a child's life for the better.
Easier said than done, right?
It can be.
I mean, reporting suspected abuse can feel like a huge burden.
Right.
Yeah, there's the fear of being wrong, of overreacting,
Yeah.
or even of making the situation worse.
I understand those fears.
Okay.
But remember, you're not alone in this.
Right.
The child protection system is designed to investigate these reports thoroughly
Okay.
and determine the best course of action.
Mm-hmm.
Think of it like this. You're raising a flag, not passing judgment.
Okay.
You're bringing a potential problem to the attention of those who are trained to handle it.
That's a helpful way to frame it.
Yeah.
Take some of the pressure off,
Right.
knowing that you're not making the final call.
Exactly.
You're just starting a process that could ultimately protect a child.
For sure.
Okay.
And remember, even if your report doesn't lead to a major intervention,
Right.
it could still plant a seed. Maybe it prompts a check-in,
Yeah.
or just raises awareness within the family or community
Right.
that someone is paying attention.
That's powerful.
It is.
And speaking of raising awareness,
Yeah.
I think it's important to acknowledge the societal factors that contribute to child abuse and neglect.
Mm-hmm.
We talked earlier about the chaotic home environment.
Right.
there's often a deeper story there.
Absolutely. Poverty, substance abuse, mental health issues, domestic violence.
Oh, wow.
These are all factors that can create an environment where abuse is more likely to occur.
Right.
It's like a pressure cooker.
Yeah.
And children are the most vulnerable to the heat.
So it's not just about rescuing children from bad situations.
Right.
It's also about addressing the root causes of those situations.
Exactly. It's about building stronger families and communities, providing support for parents and caregivers who are struggling, and creating a culture where seeking help is seen as a strength, not a weakness.
It's like tackling the problem from both ends, protecting children in immediate danger while working to prevent future harm.
Exactly.
So where do we even begin?
Yes.
It feels like such a massive issue.
Well, one of the most important things we can do is to educate ourselves.
Okay.
The more we understand about the signs and symptoms of abuse, the different forms it can take and the factors that contribute to it, the better equipped we are to recognize it and respond effectively.
And knowledge is power.
Right.
The more we know,
yeah,
the less likely we are to be paralyzed by fear or uncertainty.
For sure.
Okay.
And it's not just about knowing what to look for, it's also about knowing what to do.
Okay.
Familiarize yourself with the reporting process in your community.
Yeah.
Who do you call?
Right.
What information do they need? Having that knowledge readily available can make a huge difference in a time-sensitive situation.
So we're not just passive observers.
Right.
We're informed and prepared to act. Exactly.
And I think there's a ripple effect there.
Yeah.
When we empower ourselves, we empower those around us.
Absolutely. Imagine a community where everyone is informed and committed to protecting children.
Right.
That's a powerful force for change.
It's inspiring to think about.
It is.
And I know there are a lot of people out there already doing amazing work in this area.
There are.
Yeah.
And there are so many ways to get involved.
Okay.
Even if you're not working directly with children.
Right.
You can support organizations that are dedicated to child protection.
Yeah.
Volunteer your time. Donate to a cause you believe in.
Okay.
Every little bit helps.
So it's not just about one grand gesture.
Right.
It's about consistent, mindful action.
Exactly.
Whether it's educating ourselves, speaking up when we see something concerning, or supporting organizations that are making a difference.
Right.
We all have a role to play in creating a safer world for children.
Couldn't have said it better myself. This conversation has been so insightful.
Yeah.
I feel like we've covered a lot of ground.
We have.
But there's still so much more to explore.
There always is when it comes to such a complex and multifaceted issue.
Right.
But I think we've laid a good foundation for understanding the importance of child protection and how we can all contribute to creating a world where children are safe, loved, and empowered to thrive.
Beautifully said.
Thank you.
Now, before we wrap up this deep dive, I want to shift gears one last time and talk about prevention.
Okay.
We've talked about recognizing and responding to abuse.
Right.
But what about stopping it before it even starts?
Yeah.
What does that look like?
Prevention is about addressing those root causes we talked about earlier.
Okay.
It's about strengthening families, building supportive communities, and creating a culture where asking for help is seen as a sign of strength, not weakness.
So it's about creating an environment where parents feel supported and equipped to handle the challenges of raising children.
Yeah. We need to normalize seeking help, whether it's through parenting classes, support groups, affordable childcare, or simply having a trusted network of friends and family to rely on.
And what about educating children themselves?
Right.
What can we do to empower them to protect themselves?
That's crucial. We need to start early, teaching children about body safety, healthy boundaries, and their right to say no to unwanted touch.
Okay.
We need to create open lines of communication where children feel comfortable talking to trusted adults about anything that makes them feel uncomfortable or unsafe.
And equally important, we need to listen to children, believe them.
Absolutely.
And take their concerns seriously.
When a child feels heard and validated, it can be incredibly empowering.
Okay.
It teaches them that their voice matters and that they deserve to be protected.
This has been such a thought-provoking conversation.
Me too.
And I think we've touched on so many important aspects of child protection.
We have.
But before we wrap up completely, I'd love to hear your final thoughts.
Okay.
What is the one takeaway you want our listeners to leave with today?
More than anything, I want them to remember that every child deserves to grow up in a safe and loving environment.
Okay.
And while the responsibility of protecting children rests on all of us,
Right.
it doesn't have to be overwhelming.
Okay.
Every small act of kindness, every conversation we have,
Yeah.
every time we speak up for a child in need, we're making a difference.
I love that.
Yeah.
It's a reminder that we're not powerless in the face of this issue.
Right.
We can all be agents of change, even in our own small ways.
For sure.
And that brings us to the end of our deep dive into child protection.
Okay.
It's been a heavy but essential conversation.
Yeah.
And I hope our listeners feel empowered to take what they've learned and make a positive impact in their own communities.
Yeah.
We've explored the dark realities of child abuse and neglect, the crucial role paramedics play,
Right.
and how we can all be more aware and responsive to potential signs of danger.
Yeah.
But I want to end this deep dive on a note of hope.
Okay.
We've talked about reacting, but what about proactive prevention?
Yeah.
How do we shift from putting out fires to creating an environment where those fires are less likely to ignite in the first place?
It's a powerful shift in thinking.
Okay.
And it starts with understanding that child abuse isn't just an individual problem.
Yeah.
It's deeply intertwined with societal issues.
Yeah.
Think of it like a web.
Okay.
Poverty, lack of access to resources,
Yeah.
mental health challenges, substance abuse.
Yeah.
These all contribute to an environment where abuse is more likely to occur.
So it's about recognizing those risk factors
Right.
and working to address them systemically.
Exactly.
It's about supporting families before they reach a crisis point.
Yeah, for sure. Imagine a community where parents have access to affordable childcare,
Right.
mental health services, and parenting support groups. A community where they feel connected and supported,
Yeah.
not isolated and overwhelmed.
Okay.
That's a community where children are more likely to thrive.
And what about education?
Yeah.
How do we equip children themselves to be safer?
It starts with having age-appropriate conversations about body safety,
Okay.
healthy boundaries, and consent.
All right.
We need to empower children to recognize uncomfortable situations and trust their instincts.
Yeah.
Imagine a child who knows it's okay to say no to an adult,
Right.
even a family member, if something feels wrong.
Yeah.
That's a child who's less likely to become a victim.
And it's about creating a culture where children feel safe speaking up if something happens.
Absolutely.
Too often, children are afraid to worry they won't be believed or that they'll be blamed.
That's where we as adults have a crucial role to play.
Okay.
We need to be approachable, non-judgmental listeners. We need to believe children when they disclose abuse.
Right.
And support them through the reporting process.
Yeah.
Our response can make all the difference in a child's healing journey.
This brings to mind the fact that abuse isn't always physical.
Right.
Emotional abuse, neglect,
Yeah.
these can be harder to spot, but the scars they leave can be just as deep.
Absolutely.
Wow.
Emotional abuse can chip away at a child's self-worth,
Okay.
their sense of security, their ability to trust.
Right.
It's like a slow poison that can have lasting effects on their development and well-being.
So how do we recognize the signs of emotional abuse?
Yeah.
It seems less clear-cut than, say, a bruise or a burn.
It is, but there are patterns.
Okay.
Imagine a child who's constantly belittled,
Yeah.
criticized, or humiliated.
Right.
A child who's walking on eggshells, afraid to express themselves
Yeah.
or make a mistake.
Okay.
A child who's isolated from their peers or deprived of love and affection.
Right.
These are all red flags that should raise concern.
It's about being attuned to a child's emotional state,
Yeah.
to the subtle shifts in their behavior, and it's about trusting our instincts.
Right.
If something feels wrong, it probably is.
Exactly.
Fine.
And remember, you don't have to be an expert to make a difference.
Right.
Sometimes just being a supportive presence in a child's life
Okay.
can be a powerful protective factor. Being
Yeah.
a mentor, a teacher, a friend,
Yeah.
someone who listens, encourages, and believes in them.
That sense of connection and belonging can be incredibly powerful,
It can.
especially for a child who might be struggling at home.
It's like planting a seed of resilience,
Okay.
giving them the strength to navigate difficult situations
Yeah.
and build a brighter future for themselves.
This has been such a powerful conversation.
It has.
And I hope our listeners feel empowered to take what they've learned and create positive change in their own communities.
Yeah.
It's easy to feel overwhelmed by the scope of the problem,
Right.
but even small acts of kindness can have a ripple effect.
I completely agree.
No.
Whether it's volunteering at a local organization,
Yeah.
donating to a cause you believe in, or simply being a more informed and engaged member of your community.
Right.
Every step we take brings us closer to a world where all children are safe,
Yeah.
loved, and empowered to thrive.
Beautifully said.
Thank you.
And on that note of hope and collective action,
Yeah.
we'll wrap up this deep dive into child protection.
Okay.
Thank you for joining us on this important journey.
Of course.
Stay curious, keep learning,
Mm.
and keep those conversations going.
Hey, everyone. Ready for a deep dive into a world you might not think about every day?
I'm ready.
We're talking all things pregnancy, but with a twist.
Oh, a twist. I like twists.
You should. You're the expert for this one.
Haha. Well, I try to be.
This is all about what happens when those first responders, the paramedics, encounter pregnant patients.
Yeah, it's way more than just delivering babies on the side of the road, that's for sure.
Right. Like, I always pictured that dramatic scene, lights flashing, rush into the hospital.
You see that in the movies all the time.
But it's a whole other ball game when you really get into the guidelines they follow. It's incredible, really.
It is. I mean, paramedics need a totally different approach, a whole new skill set for these calls.
It's like they're not just dealing with one patient.
Exactly. 2 patients, each with their own, well, needs.
It's that dual focus the guidelines keep hammering on.
Absolutely. You got to think about mom and AD baby, not just one or the other.
And that's where things get really interesting. What might be a small issue for the mother could be a big deal for the baby.
Oh, yeah, for sure. And vice versa. That juggling act, figuring out those priorities.
Like a high wire balancing act, but with, lives on the line.
High stakes.
Exactly. And speaking of high stakes, we've got the source material. It highlights a whole bunch of potential threats.
Paramedics really need to be on top of their game to recognize them all.
Some are pretty obvious, right? But others are kind of hidden, like subtle clues you might miss if you don't know what to look for.
Right, like those tricky medical mysteries.
A little detective work involved.
Exactly.
It's like preeclampsia.
Oh, that one's a classic.
It can be, fatal even.
Yeah.
The early symptoms,
So easy to miss them.
headaches, some swelling, vision changes.
Things lots of people just brush off.
But a paramedic, they need to see those red flags.
Connect those dots. See the bigger picture.
Like you said, medical detectives.
Exactly.
But then you've got those situations where it's a clear emergency, no time for detective work.
Right. Things like that prolapsed umbilical cord.
Oh, that's so scary.
Every second counts in a case like that.
So you've got those immediate threats, but the guidelines also dive into complications that are, specific to different stages of pregnancy.
That makes sense, right?
Yeah,
Things change so much throughout those 9 months.
totally. What about those early months, the first trimester?
Tricky time. You might run into things like an ectopic pregnancy.
Ectopic pregnancy.
It's where their fertilized egg, it implants outside the uterus.
Oh, wow. I had no idea.
Or gestational trophoblastic disease.
Gestational what?
It's rare, but it's this group of tumors that can develop.
See, this is why we need you here.
Happy to help clear things up.
So early on in the pregnancy, paramedics are already watching for all these potential problems.
They have to be.
And as things move along, as the pregnancy progresses, I'm guessing new concerns pop up.
You bet. 2nd and 3rd trimesters, you start worrying about placental abruption.
That's where the placenta detaches.
Or placenta previa.
That one rings a bell, but refresh my memory.
It's where the placenta blocks the cervix.
Oh, right. And those can cause serious problems.
Definitely. Both of them. For mom and baby.
And that brings up something that really jumped out at me from these guidelines.
Oh, yeah. What's that?
They put a lot of emphasis on taking care of the mother first.
Yeah. Even when there's a baby involved.
That's what I thought was interesting. Seems counterintuitive.
It can seem that way. It's a tough ethical question.
But the guidelines are clear.
For the most part.
Stabilize mom. That's the priority.
Usually that's the best way to stabilize the baby, too.
There are always exceptions, right?
Sure, unique situations. Every case is different.
And to figure out the best approach, paramedics need to understand all the ways pregnancy changes a woman's body.
It's not just about adding a baby into the mix.
Right. It's about all the changes happening within the mother herself.
Absolutely.
Yeah.
Pregnancy affects pretty much every system in the body. Breathing, circulation, even how medications work.
So they can't treat a pregnant woman the same way they treat someone else.
Nope. Got to adjust their approach based on all those physiological changes.
It's like they need a whole separate playbook for pregnant patients.
Pretty much.
It's not just about one person anymore.
It's about 2 lives, totally intertwined.
And I imagine that starts with gathering information from the patient.
Oh, yeah, that's crucial. Figure out where they are in the pregnancy, what's normal for them, What's raising red flags?
Like getting that due date.
That's important, but there's so much more.
Like what?
Any pre-existing conditions, current symptoms,
Right, right.
and their whole pregnancy history.
So they're like detectives trying to piece together the whole puzzle.
Exactly. Getting that complete picture of the situation.
It's amazing how much they need to learn just to make those first assessments.
More than just checking vital signs, for sure.
It's understanding the entire context.
The whole story.
Wow. So after they've gathered all that information, what then?
Well, then it's time for a thorough physical exam.
Makes sense.
And with pregnant patients, there's one area that gets extra attention.
I bet I know which one. The abdomen.
You got it.
It's where all the action is, right? But why is it especially important in trauma situations?
Well, think about it. Car accident, a fall, the abdomen's right there in the line of fire.
Oh, I see. It's vulnerable.
Very much so. Paramedics need to check for any signs of injury to the uterus, internal bleeding, potential problems like that placental abruption we were talking about earlier.
So they're looking for clues that point to danger for the mom or the baby.
Right. And I bet you think they just do a simple press and check.
I mean, I wasn't sure, but I guess it's more complicated than that.
You bet it is. They have specific techniques for assessing the abdomen in pregnant women.
Oh, really? What kind of techniques?
They're trained to assess uterine height.
Uterine height.
It helps estimate how far along the pregnancy is. And they're feeling for contractions, checking how often they're happening, how strong they are.
And anything else?
Oh, yeah. They're also watching for any visible fetal movements or palpable fetal parts.
So they can learn a lot just from a physical exam.
A whole lot.
What about the perineum? Do they check that too?
Absolutely. The guidelines emphasize that. It's got to be a thorough check, but
what?
got to do it with sterile gloves.
Right, to minimize that risk of infection.
Yep. Safety first. Always.
So we've talked about gathering information, assessing the patient. But what happens after that?
What do you think?
Well, if they determine the patient needs to go to the hospital,
Yeah.
is there a special way to transport a pregnant patient?
You bet there is.
Yeah.
They'll almost always use what's called the left lateral position.
Left lateral, what's that?
Basically lying on the left side.
Okay, but why is that so important? It seems like a small detail.
But it makes a big difference. It all comes down to blood flow.
Blood flow.
It helps relieve pressure on a major vein that carries blood back to the heart.
So it's better for mom's circulation.
Exactly.
Yeah.
And it also improves blood flow to the uterus and placenta.
Which is good for the baby.
Exactly.
So even the positioning during transport is carefully chosen to make sure both mom and baby are safe.
It's all connected.
It's amazing how every little detail matters.
It really does. And all of this just shows how specialized this type of paramedicine is.
Dealing with two patients, those physiological changes, all the potential complications.
It's a lot to handle. Requires a unique skill set, a deep understanding of all those pregnancy-related issues.
Absolutely.
And I think our listeners are starting to see just how complicated it can be.
Definitely. It's a reminder that these paramedics are highly trained medical professionals.
They're not just driving ambulances, they're making life or death decisions out there.
They're equipped to handle these really complex situations.
Stepping into this delicate balance between two lives.
With expertise and sensitivity.
I like that. Expertise and desensitivity.
And that, I think, leads us perfectly into the next part of our deep dive.
Oh, good. I like where this is going.
We're going to explore some real-life scenarios.
Now we're talking the nitty-gritty.
Exactly. Stay tuned.
Mm-hmm.
Welcome back, everyone, to our deep dive. We're getting into the thick of things now, exploring how those paramedic guidelines actually play out in real-life situations.
Yeah, because those textbook guidelines are one thing.
Right, but seeing how it works on the ground...
That's where it gets real.
Totally. So let's jump right in. Hit me with a scenario. What kind of call might a paramedic get that really puts these guidelines to the test?
Okay, picture this. Paramedics get dispatched to a car accident.
Oh, that's never good.
No, it's not. And to make it even more complicated, the patient's pregnant, let's say about 30 weeks along.
Okay, so we've got trauma, any pregnancy.
Uh-huh. She's conscious, talking, which is a good sign.
But she's in pain.
Complaining of abdominal pain.
Oh, man, that's got to send alarm bells ringing.
It does. And in a trauma situation with a pregnant patient, what's the first thing that comes to mind?
I'd be worried about the placenta.
You got it. Could there be damage?
Like a placental abruption, right? That's what we were talking about earlier.
Exactly. That force of impact, it could cause the placenta to detach.
And that's dangerous for both mom and baby.
Very dangerous.
Lovely.
So on top of checking her overall condition.
Got to focus on the abdomen.
Absolutely. A thorough assessment is critical.
Looking for any sign of tenderness, bruising, anything that could point to an internal injury.
Exactly. And they'll be listening carefully to the fetal heart tones, too.
Make sure the baby's doing okay. What do they use for that?
A special stethoscope. It's designed specifically for picking up those baby heartbeats.
I bet it takes practice to use that.
It does. But experienced paramedics, they're really good at it.
So let's say in this scenario, they find that the fetal heart rate is a little low.
Not good. That could indicate fetal distress.
Meaning the baby's not getting enough oxygen.
Potentially. And that's a red flag. Needs attention right away.
But they still need to focus on stabilizing the mother first.
Right, we talked about that. In most cases, mom's well-being comes first.
So how do they balance that? Taking care of mom while also addressing that potential fetal distress?
Well, they can take steps to improve blood flow to the uterus.
Like how?
Simple things, actually. Positioning mom on her left side, elevating her legs.
It's all about positioning.
It can make a big difference. And they'll give her oxygen, too,
Oh, yeah, that makes sense.
which helps the baby indirectly.
It's pretty amazing when you think about it.
What is?
How these small adjustments can have such a big impact. It's like a delicate dance, making sure both patients are getting what they need.
I like that analogy, a delicate dance.
And throughout all of this, communication is key.
Oh, yeah, can't forget about that.
They're talking to the hospital.
Constantly. Updating them on the mother's condition.
And the babies.
Right. So the hospital team's ready when they arrive.
It's like a relay race.
It is. Passing the baton smoothly, making sure there's no break in care.
That's reassuring to know.
It is. Now let's switch gears for a second. Imagine a less traumatic scene.
Okay, I'm ready.
Let's say the paramedics get a call for a woman who's 38 weeks pregnant.
Oh, wow, she's close to her due date.
Very close. And she's having really intense abdominal pain.
Sounds like labor to me.
Maybe, but there are other possibilities.
Really? What else could it be?
Could be appendicitis or a urinary tract infection.
Oh, I never would have thought of that.
Those can mimic labor pains, especially in late pregnancy.
Tricky. So, once again, they need to gather all that information.
Yep, just like in the trauma scenario. But this time,
What?
they're asking specific questions about those contractions. How often are they happening? How intense are they? Any other symptoms?
Right. And getting that detailed pregnancy history.
Exactly. So no jumping to conclusions.
Got it. Careful assessment, rule things out. And what are they specifically looking for during that physical exam?
Trying to figure out the baby's position. Checking how dilated the cervix is.
And listening to the fetal heart tones.
Always. They're looking for any signs of a problem. Something that might change the game plan.
So even if it seems straightforward, like she's definitely in labor,
Still got to be thorough.
observe everything, make those careful decisions.
Every step of the way.
Now, what if they determine IS labor and the baby's coming soon? Do they deliver the baby right there in the ambulance?
Good question. Paramedics are trained for that.
To deliver baby.
Yeah, they can do it if they have to. But their main goal,
Get her to the hospital, right?
as safely as possible, ideally they'd get her there before the baby arrives.
But sometimes babies have other plans.
They do. And if they end up delivering the baby in the ambulance,
What then?
they'll still transport both mom and baby to the hospital.
Okay, that makes sense. Make sure everyone's getting the best possible care.
Right. Safety first.
These examples really show how many different situations paramedics have to be prepared for.
Doesn't it?
Trauma, labor. What other scenarios might they encounter with a pregnant patient?
Well, there's one more we should talk about, even though it's tough.
What is it?
Miscarriage.
Oh, I see. That's a difficult one.
It is, but it's a reality for a lot of families.
And paramedics are the ones who have to respond.
Sadly, yes.
So what's their role in a situation like that? It must be tough.
It is. They have to walk this line. Medical care, but also emotional support.
Because for the woman going through it.
It's devastating.
So first things first.
They'll assess her physical condition, checking for bleeding,
Yeah.
any signs of complications.
Right. The medical side of things.
But at the same time,
Have to be sensitive.
incredibly so, recognize that this is a deeply personal experience.
And often traumatic.
Yeah. So offering comfort, reassurance.
Letting her know what to expect.
Exactly. And most likely, they'll transport her to the hospital
For further evaluation.
and support,
It's a reminder that paramedics are there to support both mother and baby.
even in the most difficult circumstances.
It's about more than just the physical, isn't it?
It is. It's about caring for the whole person.
Exactly. Mind, body, and spirit.
I like that. It's holistic care.
And I think these case studies highlight something really special about these paramedics who work with pregnant patients.
What's that?
They have to be ready for anything.
You're telling me delivering a baby 1 minute,
Offering comfort during a loss the next.
all while navigating those complex medical considerations.
And respecting the patient's wishes.
Absolutely. It takes a special kind of person to handle all of that,
Yeah.
with skill and grace.
It's a demanding job, physically and emotionally.
No doubt about it.
So much responsibility, 2 lives in their hands.
Intricate medical scenarios, intense emotions,
All to carry?
and it really highlights the need for ongoing training,
Yeah.
education.
Because things are always changing.
They are. New research comes out, guidelines get updated.
And these paramedics need to be on the cutting edge.
Yep, to provide the best possible care.
Okay, so we've covered those real-world scenarios. Trauma, labor, miscarriage, each one with its own unique challenges.
But there's one more layer we need to peel back.
Oh, what's that?
The ethical dimension.
Now things are getting really interesting.
Because when you bring pregnancy, emergency care, and personal autonomy together,
Things can get ethically complex.
very complex.
Yeah.
And that's what we're going to explore in the final part of our deep dive.
Welcome back, everyone. We're wrapping up our deep dive into pregnancy and paramedic care, and this time we're hitting the road.
Oh, hitting the road, you mean?
Literally. We're talking about the transport phase, getting that pregnant patient to the hospital.
Ah, I see. And that's not as straightforward as it might seem.
Not at all. Lots of things to consider, especially when you've got 2 patients to worry about.
Right, mom and baby. Both got to get there safe and sound.
Exactly. So, what are the big things paramedics are thinking about during transport?
Well, first and foremost, they're constantly monitoring both patients.
Monitoring, like checking their vital signs.
Exactly.
Yeah.
Blood pressure, heart rate, all that.
And for the baby.
Got to keep an eye on those fetal heart tones, make sure everything's okay in there.
I bet that takes some serious multitasking skills.
It does. Paramedics have to be on top of their game. Any changes could mean trouble. They got to be ready to act fast.
So they're basically running a continuous assessment.
Pretty much. Throughout the entire transport.
What kind of equipment do they use to monitor everyone? I'm picturing all those gadgets you see on medical shows.
Uh-huh. Some of it's similar. They'll have those standard tools for mom, blood pressure cuffs, pulse oximeters, the usual suspects.
Right, right. But what about for the baby? How do they keep tabs on what's going on in there?
Ah, for that, they've got a special tool. It's called a fetal Doppler.
Ah, Doppler.
It's like a little microphone that lets them listen to the baby's heartbeat.
Oh, wow. Technology's pretty cool.
It is. And it could be a real lifesaver, especially in those high-risk situations we talked about earlier.
Like those trauma cases.
Exactly. Or if there's a chance the placenta's in trouble.
They're always on the lookout for signs of a problem.
You bet. Every minute counts in those scenarios. And they might also give mom supplemental oxygen during transport.
To help the baby get enough oxygen.
Exactly. It's all about maximizing those chances for a good outcome.
Now, this might sound like a silly question,
What is it?
but does the type of ambulance matter?
Yeah. You'd be surprised. Actually, yeah. The vehicle itself can make a difference.
How so?
Ideally, you want an ambulance with a smooth ride. Good suspension system.
Why?
So you minimize those bumps and jolts along the way.
Oh, right. Can't have mom bouncing around back there.
Exactly. And of course, the ambulance has got to be stocked with all the right supplies.
For pregnant patients, specifically?
And for potential newborn care, just in case.
So it's not your average ambulance, it's a specialized unit.
Pretty much. Got to be prepared for anything.
And then there's that positioning thing we talked about earlier. Remember that left lateral position?
Oh, yeah. Lying on the left side.
It helps with blood flow, right?
Yeah, you got it. To the uterus and the placenta. Keeps things moving for the baby.
So if she's on a stretcher or a spinal board...
They tilt it a bit to the left. Achieve that same effect.
It's incredible. All these details, they all matter.
They do. It's about creating the best possible environment for both mom and baby.
So we've got the monitoring, the equipment, the positioning. What else? What about communication?
Oh, that's huge. The paramedics stay in touch with the hospital the whole way.
Giving them updates on the patient's condition.
Exactly. Any changes they see, it's like a heads up so the hospital's ready when they pull in.
That makes a lot of sense.
Seamless transition of care. That's the goal.
So the hospital team knows exactly what to expect.
Yep. Time of arrival, mom's vitals, baby's heart rate. Any interventions they've done en route.
It's a team effort, everybody working together.
That's what it's all about.
Anything else they do to prep the hospital?
Sometimes they'll give a heads up about specific concerns, like if they think mom might go into preterm labor or if the baby's showing signs of distress.
So they might need that neonatal resuscitation team standing by.
Exactly. It's all about giving the hospital as much information as possible so they can provide the best care right away.
It's like painting a picture for them.
Perfect analogy. So they know what they're walking into.
And that just goes to show the transport phase isn't just about driving to the hospital.
Nope. It's a vital part of the whole care plan.
It's its own dynamic phase.
Assessment, intervention, communication, all happening at once.
It really shows how skilled these paramedics have to be.
It does. They're thinking on their feet.
Making decisions under pressure.
Adaptable, knowledgeable, confident.
And they've got the well-being of 2 patients in their hands.
Those small feet.
Well, I think we've covered a lot of ground in our deep dive.
We have. Those guidelines, those real-life scenarios, the ins and outs of transport.
It's been fascinating, and I hope our listeners have gained a new appreciation for what these paramedics do.
Me too.
Uh-huh.
It's a challenging field, but so rewarding.
Absolutely. They're on the front lines caring for mothers and babies, and they do it with incredible skill and compassion.
I couldn't have said it better myself.
So to all the paramedics out there, thank you for everything you do. And to our listeners, thanks for joining us on this deep dive.
Until next time.
Stay curious.